Hi, everybody. Thank you so much for this opportunity. It's a privilege to introduce this brand new study, From Silos to Synergy, how the funding landscape is shifting for maternal and newborn health, justice, and equity. This brand new report is developed by Global Health Visions in partnership with the National Birth Equity Collaborative and my organization, Global Force for Healing. Next slide, please. It's been over 4 years since we brought to the RMC Council the idea of donor engagement and the need for a landscape analysis, a current one, of funding in our field in order to raise awareness and raise dramatically more funds for maternal newborn care worldwide, including the United States. And it's been 10 years since the first landscape analysis of US-based donors that Global Health Visions did. That's the study you see on the left in 2011. The world has obviously dramatically changed since then. So we decided the time was right to commission an updated study intended as a companion to the study you see in the middle, Funding Equity, Birth Justice, and Human Rights in Maternal and Newborn Health, which we helped publish in 2019. So it's my distinct pleasure to introduce two key members of the study team, Susannah Hurd, Vice President of Global Health Visions and one of the lead authors of this report and the 2011 report, and Kelly Davis, Vice President of Global Birth Equity and Innovation for the National Birth Equity Collaborative. Other members of our team will monitor the chat box. We hope to have a really robust conversation with you after the presentation. Over to you, Kelly and Susannah.
Thank you. Good morning. Can we get the next slide, please? So a little bit about how we conducted our study. We started with desk research. Interviewees were identified and using a snowball sampling technique in order to build on the expertise and relationships of our varied organizations with their different perspectives. We then moved to our most interesting part of our process, I believe, which was designing an in-depth key informant interview guide to understand the funding landscape and how folks were operationalizing racial equity, which we thought was really a key component considering what happened across the world in 2020, not just with the COVID-19 pandemic, but the global civil unrest due to police brutality in the US and other states and countries affected by the transatlantic slave trade. Our interview guide that we used, we were able to interview 30 US-based private foundations, donors, and funder collaboratives. I really want to note that private sector donors were not prioritized for this particular study. However, two private sector funders, Merck for Mothers and the Johnson & Johnson Foundation, who are heavy hitters, were included because of their pronounced leadership in the maternal and newborn health landscape, as well as their frequent partnerships with other types of donors and funding collaboratives. We also conducted written surveys or interviews with 15 civil society organizations, research institutions, networks, and grassroots organizations. Next slide. Many of you on this call work in regions of the world that endured wealth extraction, colonialism, and the transatlantic slave trade, and are deeply familiar with the challenges of the current philanthropic landscape. But there's some good news. Aid for reproductive, maternal, and child health has greatly increased, at least through 2012, with the largest percentage of funds going to child health, followed by reproductive health. In this context, reproductive health is referring to activities like contraceptive access. Maternal and newborn health received the smallest amount of funding, but you all know this. That's why we've been working together to share best practices within this coalition to really support respectful maternity care and shift what the maternal health landscape looks like across the globe. What the US government provides in foreign aid can vary, as we all know. And I really hope that our newest administration restores the funding that was reduced over the last few years due to American exceptionalism. Most philanthropic funds across the globe come from the US, but I was excited or surprised to note that nearly 50% comes from the Bill and Melinda Gates Foundation. Next slide. Funding in the US in response to the decades-long maternal health crisis, which mostly affects Black and Indigenous women. In 2020, the US Department of Health and Human Services announced a call to action to improve maternal health with over $116 million in funding. Our organization, the National Birth Equity Collaborative, has been a staunch advocate for the Black Maternal Health Momnibus Act of 2021. If it passes and actually becomes legislation, it will advance important policies like 12-month postpartum Medicaid coverage, which would ensure that low-income mothers and people living in poverty would have access to free or low-cost health care for the full postpartum period, because we know that most of the time in America, folks are kicked off their health insurance via Medicaid 6 weeks. But there are a lot of deaths that happen after 6 weeks post or longer postpartum. Even with national level progress, there's lots of state variability. Many states with large proportions of Black, Indigenous, and Latin American residents who are all more likely to experience poor birth outcomes do not have supportive policy environments. And if you're looking for a good resource to understand how American policy can differ, I would really suggest the March of Dimes, who issues state reports for birth outcomes. And now I'm going to pass it over to my colleague, Susannah.
Thank you, Kelly. Hi, everyone. If we could go to the next slide, please. So I'm going to talk through some of the themes that we garnered through our interviews and desk research. We opted to present the themes kind of across both the US and global landscapes, really looking at this collectively, even though historically there really has been a lot of siloing between these two landscapes. And while we spoke with donors that focused only on sort of global context and some that focused only on the US context, there were also donors that focused on both. And we really saw a lot of common themes across both landscapes. All of the funders that we spoke with, the funders and funder collaboratives that were interviewed, said that equity, anti-racism, and/or racial justice were important in their funding priorities or their network priorities. Now, obviously there are donors that are very different stages of how they are addressing those issues, but it was obviously good to hear that all were thinking about and starting to really prioritize these issues. A lot of interviewees described how their investments are designed to support indirect interventions, including policy change, leadership development, and advocacy. We also heard a lot of really consistent feedback around efforts to shift more funding and decision-making to community organizations and organizations in the global South and among global funders. And a lot of the funders we spoke with reported more collaborative working relationships with grantees in terms of encouraging and supporting more decision-making at the level of the organizations and communities, which is quite different from the report we did in 2011, where it was very clear that there was quite a donor-driven agenda. Next slide, please. So we talked with quite a few funding collaboratives, networks, and pooled funds, as well as individual donors who expressed the value of these types of networks and collaboratives. And so there was really pretty strong agreement around how these types of networks can support information sharing, collaboration, can help to increase impact and really identify and fill gaps. There's increasing women's philanthropy groups and funds that are focused on issues that affect women and girls. And then there's quite a few donors that are really focused on data and initiatives to increase and improve the quality of data, to ensure that there is disaggregated data, which really helps to support what we need around advocacy and identifying where to focus programming to address equity issues. Next slide, please. So this slide highlights just a few novel funding models and public-private partnerships. We profiled or noted in the report that there was an OECD report that noted that in 2018 that 91% of foundations still preferred a traditional grant-making approach. However, there may be increasing evidence that more donors are considering non-traditional approaches. And so we, certainly did not capture all the novel funding models and public-private partnerships out there, but wanted to highlight a few examples. So here are three: the Nurture New Jersey initiative, Birth Center Equity, and two initiatives from Merck for Mothers in the US and globally, all of which sort of showcase how funders are working with one another, how they are working with sometimes private sector, how they're working closely with civil society organizations, with governments, et cetera, to really work collaboratively towards common goals. Next slide, please. There really was also a very consistent theme around all the donors that we spoke with, around a real effort to try to shift resources to more grassroots organizations, those led by communities of color, indigenous groups, and those led by the communities that they're serving. Again, to my point earlier, there is really a range in terms of where where funders are in this process, but this is really top of mind for a lot of donors right now. There's also a lot of recognition among donors around the importance and necessity to fund and support capacity building, leadership development, power building as key to building a movement for maternal and newborn health and rights. So not just funding kind of the programmatic and service delivery side, but really kind of thinking more holistically around building this movement if we're really going to shift the needle. Reducing silos and addressing social determinants of health. I think, we've all sort of heard about these buzzwords and heard about these and are very well familiar with how important this is. And certainly with the shift to the SDGs, have seen a more holistic approach, but it was helpful to hear that a lot of donors are really trying to shift to think about maternal and newborn health, together as a mother-baby dyad, as well as kind of many more integrated approaches looking at societal, environmental, structural factors that impact birth outcomes. Next slide, please. So some of the gaps and challenges that we identified, in some ways also sort of map to some of the themes. So while there's great progress, some of the same areas are places where we continue to need more change and where there's still existing gaps. So there is a continued sort of lack of funding for local organizations and those led by Black, Indigenous, and people of color. Many interviewees confirmed that, historically philanthropy has consistently sort of overlooked these organizations. And while there really is a concerted interest and movement, I would say, towards shifting that norm, there's still a long way to go. There's also was expressed by a number of donors that there has not been enough funding for a clear policy agenda, and that this is a particular gap if we're going to, again, as I noted earlier, really move the needle on this issue. Next slide, please. An interesting and I guess, theme and gap that we heard pretty consistently. And this may be something you all are well aware of, or perhaps this is new, but there's a real disconnect between foundation staff, sort of the program officers and those who are most connected to grantees, and the boards and sort of leadership and trustees. And so it's the staff that tend to have a better understanding of these intersectoral issues, such as racial inequality, power dynamics, et cetera, and that there's a real need to sort of get the boards and the trustees and leadership more engaged in understanding these intersectoral issues. Logistical challenges, again, this is sort of a frustrating one, I will say, because you know, while there's a lot of talk about shifting to grassroots organizations, community-led organizations, organizations led by people of color, there were, particularly among the larger donors, many expressed that they are struggling and grappling with how to make that shift. And I think there's definitely, as Kelly was saying earlier, while there's been a big shift because of the movement for Black lives in the United States and how that really had this ripple effect on the whole health and development community. And so there's definitely an impetus and a real desire to shift, but it sounds like, you know, we're still hearing big funders say that logistically they're not quite set up and they're trying to figure out ways to bolster their country level staff or look at ways to identify intermediaries to support more grassroots groups. Next slide, please. The coordination and alignment among funders, I think we heard that this is improving, but still nascent, particularly in the maternal newborn community and birth equity community. So we talked to several funders collaboratives, like the Funders for Reproductive Equity, Hispanics in Philanthropy, Grant Makers in Health, and the Midwifery Funders Group. But with the exception of the Midwifery Funders Group, you know, none of these collaboratives are really explicitly focused on maternal newborn health issues. And there was a real desire among many of the donors we spoke to increase and improve collaboration. And lastly, concerns about whitewashing. So both domestically and globally, several donor interviewees acknowledged that they have sort of operated from a savior complex, of really touted empowerment programs, which perpetuate some of these power imbalances. Many communities, as we all know, are powerful in their own right, but inequitable distribution of resources, historical trauma, violence, and disenfranchisement have resulted in the need for programs that focus on justice and equity. And these terms of reproductive and birth justice are relatively new concepts, particularly in the global context, but also to many US funders. As these concepts and terms become more prominent, there are concerns, particularly among community actors in the birth justice field, that the holistic and all-encompassing meaning of birth equity and racial justice will become diluted or co-opted by predominantly white-led organizations, which are historically funded at much higher rates than organizations led by Black, Indigenous, and people of color. Next slide, and I'll turn it back over to Kelly.
Thank you, Susannah. We know this slide might be a little hard to digest, but we will be sending this out. It's actually something I'm pretty sure many of you are familiar with. It's really a visualization of how racism and gender oppression are institutionalized and how philanthropy's current model, right? On the left, you can see there's top-down decision-making, and often wealthy white programmatic leaders and boards of directors are making decisions of what to fund without any community engagement or diverse representation in leadership, even within the organization. This results in siloed funding, Contraceptive access, gender-based violence, maternity care, HIV, and newborn health are often all siloed with their own programmatic teams, which never talk to each other, despite being inextricably linked, no matter where you are across the globe. The institutions, as a result, that need the most funding are often disconnected from all the resources they need. And as Susannah talked about, those are the grassroots kind of smaller organizations that are often disconnected and unable to access or jump through the restrictive hoops that are placed by large philanthropic institutions and collaboratives. What we're calling for in this report is a drastic shift that places the most marginalized people at the center of decision-making and grant-making. Our vision, as represented here, is a new model that has less restrictive, community-led and responsive decision-making integrated in a person-centered approach, right, to really address and institutionalize equity and justice. Next slide. And these are some of the things that we believe are going to help us get there. According to our key informant interviews and the diverse experiences of the National Birth Equity Collaborative, Global Force for Healing, and Global Health Visions. We need to decolonize philanthropy and international development. Point blank. And I mean, we could stop the presentation right now and just really focus on that. We have to do that if we're really going to shift, if foundations are really going to shift the things that they say they're going to shift, they're going to have to drastically change the way that they operate and shift significantly more funding to locally led grassroots organizations and Black, Indigenous, and people of color led institutions, rather than oftentimes what we see is white-led NGOs coming to different parts of the world where they don't have the relationships in community contexts and implementing programs that, you know, do not reach their full potential because of the ethos of the whole entire funding mechanism. You know, relationship building is key. Folks tend to give often to the same people over and over again without understanding how movements are shifting, particularly those that are led by youth and people of color, LGBT communities. Investing in community power building for maternal and child health. If we really focus just on, you know, things like reproductive technology, we will never get to shifting what it looks like to be capable of pregnancy across the world, right? It really, we have to shift from just clinical provider models to power building models if we ever gonna envision or actualize the world we envision. I talked about this earlier. So did Susannah, diversifying foundation boards, leadership structures, and decision-making processes. We need people with lived experience or understanding of the community context in the regions of the world and the communities that they are funding, making decisions about what to fund. Facilitating more engaged, informed, and coordinated donor bases, pretty self-explanatory, and dismantling the silos around intersecting health issues. I mean, the fact that reproductive health is seen as like different from maternal child health or different from newborn health, when, you know, both the mother and the pregnant, or the pregnant person and the baby, are going through the same birthing experience, right? They're not separate, but yet we have these false distinctions. And exploring and supporting innovative funding models and new approaches, some of which Susannah detailed earlier. We need to really advance innovation if we're really going to have a more equitable world. So with that, I just want to thank you for the opportunity to present today.